Well, good afternoon, everyone. As I think you may have already heard, we're going to continue the discussions within our conference on the differences that we have, that we're continuing to try to litigate. Consequently, we will not be on the bill this week. We think the status quo is unsustainable for all the obvious reasons we've discussed over and over and over again. And we're optimistic we're going to get to a result that's better than the status quo.
We know the fight is not over. That is for sure. We're not resting on any laurels. Over the next couple of weeks, we know that Leader McConnell will try to use a slush fund to buy off Republicans, cut backroom deals to try and get this thing done.
Obviously, we're continuing to be optimistic. The president is committed, as he said, and all the members of the administration have said repeatedly, to repealing and replacing Obamacare, working with the Senate, working with the House, making sure we get the best bill. For us, it's never been about the timeline, but about getting the best piece of legislation that helps the most Americans.
This is a process of bringing the conference together, uniting Republicans. I think we're making steady progress in that regard, but we still got a way to go.
I think that something as important as health insurance ought to be deliberated until people are satisfied.
I think this bill, as it becomes more public and people understand the impact on their personal lives, will be even less popular. That's why I think a new approach, a constructive approach, a bipartisan approach is the right way to go.
Well, I would hope at some point we're going to get to the place where we're all going to work together to make sure that health care is, we improve on the Affordable Care Act and we make sure that it's affordable and available to the people who need it.
So we're going to talk and we're going to see what we can do. We're getting very close. But for the country, we have to have health care. And it can't be Obamacare, which is melting down. This will be great if we get it done, and if we don't get it done, it's just going to be something that we're not going to like, and that's okay, and I understand that very well.